You break your wrist. Maybe you slipped on ice. Maybe you fell off a bike. Maybe you reached out to catch yourself and heard that sound. The one you immediately know means something has gone very wrong. Within minutes, someone is helping you. Within an hour, you're in an emergency room. Within a few hours, there's an X-ray, a diagnosis, a cast or a surgical plan, pain medication that actually works, and a prognosis measured in weeks, not guesses. Now strip all of that away. Same wrist, same break, same sound, but no emergency room, no X-ray, no cast material, no pain medication beyond whatever plants happen to grow nearby, no doctor, no one who has ever seen an X-ray of a broken bone, just you, your group, a broken wrist, and the next several weeks of trying to survive while one of your most important limbs doesn't work. What happened? Not in the abstract, not they probably just tried to splint it somehow, but specifically, practically, what did early humans actually do when a bone broke? And more importantly, what does the archaeological evidence tell us about how often they survived it? The answer is more surprising than most people expect, and it tells us something profound about the capabilities of our ancestors and the social bonds that held early human groups together. Let's get into it. Let's start with the bone itself, because understanding what happens when a bone breaks helps explain what early humans were dealing with and why it mattered so much. A fracture is not simply a structural problem, it's a medical event that triggers a cascade of physiological responses. The moment a bone breaks, blood vessels within and around the bone are damaged, causing bleeding and bruising. The surrounding tissues swell. Nerve endings signal pain signals so intense that in severe fractures, shock is a real risk. The immune system activates to begin the complex process of repair, which in an uninfected fracture proceeds through a predictable sequence. The formation of a blood clot, then a soft callus of fibrous tissue, then a hard callus of woven bone, then a gradual remodeling into normal bone structure. This process takes weeks to months, depending on the bone, the individual, and the quality of immobilization. Immobilization is the key word. A fracture that is held still, aligned correctly, and protected from further stress heals far better than one that is repeatedly disrupted. This is the fundamental principle behind the cast. Not that it adds anything to the bone's healing capacity, but that it removes the variables that interfere with it. Without immobilization, a fracture can heal misaligned, producing a deformity. In severe cases, if the bone ends are repeatedly disrupted, healing fails entirely, producing what's called a non-union, a fracture that simply never heals. So the question for early humans was, could they figure out, without any knowledge of the underlying biology, that keeping a broken bone still improved outcomes? And could they do something practical to achieve that stillness in conditions where moving, gathering food, and avoiding predators were constant demands? The evidence says yes. Compellingly and repeatedly yes. The archaeological record of healed fractures in early humans is extensive. Paleopathologist Eric Trinkhaus at Washington University in St. Louis, whose work on prehistoric injury and care we've encountered before, has documented healed fractures in Neanderthal and early modern human remains going back hundreds of thousands of years. These are not fractures that failed to heal. They are fractures that healed. Bones that broke and then went through the full biological repair sequence, producing the distinctive callus formation and eventual remodeling that shows up clearly in fossilized remains. Healed fractures in the fossil record are important evidence for two distinct reasons. First, they demonstrate that the individual survived the fracture, which means the group provided enough support to keep the injured person alive during the weeks of reduced mobility. Second, they often demonstrate that the fracture healed reasonably well, which means something was done to immobilize and protect the injured limb, because the alternative, letting it move freely, typically produces the kind of malunion and deformity that shows up differently in the fossil record. Second, deze armen dras to the direct begoing fit. Second, the vulnerable over the Broadsirion Tummel. One of the most striking examples comes from the Neanderthal remains at Shanidar Cave in Iraq, the same site we've discussed in other contexts. The Shanidar 1 individual, an adult male, showed healed injuries so extensive that his survival for years afterward is considered strong evidence of sustained, deliberate group care. Among his injuries were what appear to be healed rib fractures, in addition to the more famous skull and arm injuries. Each of these required time to heal, time during which he would have needed food, shelter, and protection provided by others. But let's be specific about what early humans actually did with a fresh fracture, because the evidence allows us to reconstruct, with some confidence, the basic elements of prehistoric fracture management. The first priority in any fracture is reducing the displacement, getting the bone ends back into reasonable alignment before swelling makes this harder. This requires knowledge of normal anatomy, some courage, and a willingness to cause short-term pain to prevent long-term deformity. Archaeological and ethnographic evidence suggests that early humans had this knowledge and were willing to apply it. Traditional bone-setting practices documented across cultures worldwide show a remarkable consistency. Manual manipulation to restore alignment, performed quickly, followed by immobilization. The second priority is immobilization, and here is where early humans showed genuine ingenuity. The materials available for splinting in the prehistoric world were limited but not negligible. Straight branches, bark strips, animal hides, tendons, plant fibers. These could be combined to create splint and binding systems that, while far less effective than a modern plaster cast, provided meaningful immobilization for healing fractures. Archaeological evidence of prehistoric splinting is rare because organic materials don't preserve well. But there are important exceptions. An ancient Egyptian case from around 2600 BCE shows wooden splints bound with linen strips, the oldest known example of formal splinting. But the technique itself almost certainly predates this by thousands of years. Ethnographic records of traditional bone-setting practices in cultures without access to modern medicine consistently describe some form of splinting and binding as standard procedure, suggesting a practice so widely distributed it must be ancient. There's also the question of pain management, because a broken bone without effective pain relief produces a level of suffering that would have been debilitating for an early human hunter-gatherer whose survival depended on continued physical function. And here the story connects directly to what we know about early plant medicine. Multiple plants with analgesic properties have been used by traditional cultures worldwide to manage fracture pain. Willow bark, with its salicylic acid content, would have been among the most useful, reducing both pain and the inflammation that accompanies acute fracture. Certain traditional cultures used preparations from plants containing compounds similar to opioids for severe pain. Others used plants with sedative properties to allow the injured person to rest during the critical early healing phase. We can't say with certainty what specific plants early humans used for fracture pain, but we know they had access to a sophisticated pharmacological knowledge base developed over hundreds of thousands of years. And we know that pain management was a central concern of traditional medicine everywhere it's been documented. It would be surprising if early humans facing the intense pain of a fresh fracture had nothing to offer. Now let's talk about the fractures that are most revealing in the archaeological record. Not just the ones that healed, but the ones that healed despite being fractures that, without some form of care, would likely have been fatal. A femur fracture, a break in the thigh bone, the largest bone in the body, is one of the most dangerous injuries a human can sustain without modern medicine. The femur is surrounded by large muscle groups that, when the bone breaks, can cause catastrophic bleeding. A badly managed femur fracture can kill within hours through blood loss, or within days through infection. And even if it doesn't kill immediately, a person with a broken femur cannot walk, cannot hunt, cannot gather food, cannot flee from predators. They are entirely dependent on others for survival, and yet healed femur fractures appear in the fossil record. Early humans survived broken femurs. This is not a minor finding. It means that early human groups were capable of providing the sustained, intensive care, including food, protection, pain management, and immobilization assistance, necessary to keep a completely immobile person alive through weeks of healing. One of the most discussed examples is from a site in Atapuerca, Spain, the same site that produced the extraordinary pit of bones evidence. Among the hominin remains at Atapuerca, researchers have identified individuals who survived significant injuries, including what appear to be major bone fractures, long enough for those injuries to show healing. These individuals, living approximately 430,000 years ago, could not have survived without group support. The social implications of this are profound, and they're worth sitting with. We tend to think of prehistoric life as brutally Darwinian, survival of the fittest, the weak left behind, injured individuals abandoned because they represented a burden that natural selection would eliminate. This image is not just uncomfortable, it's wrong. The evidence of healed fractures, of individuals who survived injuries that would have left them entirely dependent on their group for weeks, tells a different story. It tells a story of communities that chose to support their injured members, not because it was strategically optimal in any simple sense, but because the relationships within the group, the bonds of family, friendship, mutual dependence, and something that looks very much like what we would call compassion, made abandonment unthinkable. Researcher David Tilley at the University of Birmingham has developed what he calls the archaeology of care, the systematic study of evidence for caregiving behavior in the prehistoric record. His work shows that examples of individuals surviving serious injury through apparent group support go back at least 1.8 million years, to early Homo species in Africa. The capacity for care, for choosing to support vulnerable members of the group, appears to be one of the oldest human behaviors we can document. There's something else in the fracture record that I find genuinely moving, the pattern of which bones broke most often in early humans. Arm fractures, specifically the radius and ulna, the bones of the lower arm, are among the most common fractures in the fossil record. And many of these show a specific fracture pattern that forensic anthropologists call a perifracture or a defensive fracture. The name describes its most common modern cause, raising your arm to block a blow. This is sobering data. A significant number of the broken bones we find in early human remains are consistent with violence, interpersonal violence, the same violence that produces these fractures in modern forensic contexts. But here's what makes this evidence complicated in a useful way. Many of these defensive fractures healed. Individuals who were attacked, who raised their arms to protect themselves and broke bones in the process, survived. They were cared for. And we know this because we find their healed bones. Violence and care coexisted in early human groups. The same communities that generated interpersonal conflict also generated the compassion to nurse the injured back to health. This is not surprising to any modern human who has thought carefully about it. But it's striking to see it written in the bones of people who lived hundreds of thousands of years ago. Let me close with something that connects this ancient evidence to your own life in the most direct possible way. The basic biology of bone healing has not changed. The same mourning behavior they display for their own dead that followed a fracture in a Neanderthal's femur 100,000 years ago follows a fracture in your femur today. The blood clot, the soft callus, the hard callus, the remodeling, your body does this the same way their bodies did it. The difference between you and them is not biological. It's technological and social. You have X-rays that show exactly what happened. You have casts and surgical hardware that provide perfect immobilization. You have pain medications that are genuinely effective. And you have a social structure, hospitals, insurance systems, support networks that ensures you can rest and recover without the survival cost falling entirely on your immediate companions. They had none of the technology, but they had the social part. They had people who stayed, people who brought food to someone who couldn't move, people who held a splint in place and changed the binding when it loosened, people who knew which plants reduced the pain, people who, in the most practical and direct sense, refused to let someone they cared about face the worst alone. That's not a small thing. That might be the most important thing. The technology is remarkable, and it matters enormously. But the willingness to care, to stay, to help, to give your time and your resources to someone who temporarily cannot survive without you, that was there first. That may be the oldest human technology of all. If this one made you think about the person who last took care of you when you were hurt, you know what to do. I'll see you in the next one. There's one more thing worth examining closely before we close: the specific types of fractures that appear most often in the prehistoric record and what they tell us about the daily lives and risks of early humans. Compression fractures of the spine appear with surprising frequency in older individuals in the fossil record. These are the fractures caused by the vertebrae being crushed under load, the kind that happen when someone falls heavily, or when the cumulative effect of a physically demanding life wearing down the bone structure eventually causes a vertebra to collapse under normal loads. In modern populations, spinal compression fractures are strongly associated with osteoporosis. In prehistoric populations, they're associated with a life of carrying heavy loads, repeated physical labor, and the accumulated trauma of subsistence living. These fractures are painful, chronically painful, and they're not the kind of injury that heals cleanly and fully. A compressed vertebra stays compressed. Early humans with healed spinal compression fractures were living with ongoing pain, with reduced mobility, with a changed relationship to the physical demands of their daily lives. And yet they continued living. Someone fed them. Someone helped them. Someone valued their presence in the group enough to accommodate their limitations. This changes the picture of early human groups in an important way. These were not communities that only valued physical capacity, that discarded members the moment they could no longer hunt or carry loads at full capacity. They were communities that contained and supported and found use for members across the full range of ability. The elder with the compressed spine who could no longer run but could still teach, still remember, still advise, they had a place. And the bones tell us they used it. There is also the evidence of fractures that didn't heal well. Malunions, fractures that healed in poor alignment, appear in the fossil record too, and they tell their own story. A malunion in a weight-bearing bone like the tibia produces a limp. A malunion in the forearm can permanently reduce the range of rotation. These are lasting consequences, visible in the bone structure for the rest of the individual's life. And the individuals who carry them in the fossil record often show evidence of having lived for years, decades even, after the injury healed badly. What does this tell us? It tells us that early humans could survive significant permanent disability, that communities made room for members who limped, who had reduced arm function, who had changed permanently by an injury that didn't fully resolve. The social inclusion was not contingent on perfect physical function. This is perhaps the most quietly radical finding in the archaeology of prehistoric injury. The prehistoric world was not the brutal, efficiency-maximizing environment of pop evolutionary imagination. It was a world where people with permanent injuries found ways to contribute, and where communities found ways to include them. That's a different story than the one most people carry about our prehistoric past. And it's a better one. There is one final dimension of prehistoric fracture care that almost never gets discussed, and it connects the physical to the emotional in a way that I think is important. Pain. Not just the management of physical pain, but the social and emotional response to it. When someone in an early human group broke a bone, the people around them heard it, saw the injury happen or found the injured person, and responded. Every account of traditional bone-setting practice documented by anthropologists includes a social dimension, the gathering of the group, the presence of others, the physical contact of people holding and supporting the injured person during the acute phase. This social response to pain is not incidental. Research in modern pain science consistently shows that social support reduces the subjective experience of pain. Physical contact with trusted others reduces cortisol levels and activates the same neurochemical pathways that pain medications target. The presence of people you trust, people who touch you carefully and speak to you calmly, is a genuine physiological intervention in the pain experience. Early humans didn't know any of this, but they did it anyway, because it was the natural response to seeing someone they cared about suffering, and because, on some level that precedes conscious knowledge, they had learned across generations that this response helped. Researcher Naomi Eisenberger at UCLA has studied the neural overlaps between physical pain and social pain, the pain of rejection, loss, isolation, and found that they share underlying brain circuitry. Physical pain and social pain are not just metaphorically similar, they're neurologically related. and their mirror. Physical comfort and social connection are also neurologically related. The warmth of a hand, the presence of a familiar face, the sound of a calm voice. These are not just emotionally meaningful. They are, in a measurable sense, analgesic. When an early human sat with an injured group member, held their broken arm still, spoke to them through the worst of the pain, they were doing something real. Something that mattered at the level of neurons and neurochemistry. Not because they understood any of that. Because they cared. And caring, it turns out, is one of the most powerful medicines our species has ever developed.